Hello and welcome to the 10 Days of Empowerment for Women with Parkinson's. I'm Kimberly Berg. I would like to introduce you today to someone I completely admire. I've had the pleasure of working with her over the past years. This is Deb Jones. She is a doctor of physical therapy, board certified clinical specialist in geriatrics. She is also certified in vestibular and balance, concussion and brain injuries, and also pelvic health. She's here to address the very, very annoying and complicated issues of foot and leg cramping and what she would do for people when they come to see her in clinic. So I am so excited about having you here with me today, Deb. I'm going to turn it over to you, but really, as you know, this is a quality of life issue for people with Parkinson's when they get that foot cramping. I've had women say that they can't dance, they can't walk, exercise. It's frightening. It happens in the night, during the day at social events. So how would you address this when they come to see you with the same reports?
Okay, well, thank you so much for having me, Kimberly. I so appreciate what you do for all the people with Parkinson's disease. As a physical therapist, if a person with Parkinson's was coming in to see me, the first thing I like to do is not just put them into the box of Parkinson's. I like to look at them as a person, find out what they've done before their Parkinson's, during their Parkinson's, what's going on now, when did it come on, and what has their life been like? What kind of activities did they do in the past? What are they doing now? Because often these people can be 60 or over, sometimes younger, and they come with a lot of things that have gone on during their life. So the cramps that you're experiencing could be from the Parkinson's, but it also could be from something else. So I like to talk to them about several different things. One is, when are they getting the cramps? Before and after, before exercise, after exercise? Is it just during the night? Is it in the morning? When they get them, lets me know more what's going on with the systems involved. So several things that we could talk about is, and this would be for anybody, whether they had Parkinson's disease or not, is, are you drinking enough water? So how much is enough water? Well, our nephrologists, which are kidney doctors, like to say they like each kidney bathed with a liter of water a day. So that's about 64 ounces. So that would be a pretty good standard for most people. If you're larger, it's a hot day, you maybe have a little more. If you're smaller, and you might not drink quite as much. So keeping that hydration is important to keep your muscles moving. So it's just, we're made mainly of water, and we need to keep our bodies hydrated for all of our organs and systems to work properly. The second thing is, sleep disorders can affect pain. And so if you're having pain anyway and you're not sleeping well, you can also have some changes in how you're feeling the next day, and possibly some changes in how your muscles feel as well. So then going on, if you came in to see me, I would want to look at all your systems kind of from a perspective of from outside in, basically, or inside out. So we look at, and I'll bring this little model up, we look at the foot structure, and we want to find out, do you have the range of motion that's required for the movement you're trying to do? So I would look at your great toe range of motion and strength. We would look at your ankle range of motion and strength, both in plantar flexion, dorsiflexion, and the movements from side to side, to see if I can elicit cramps by moving your foot. Having your foot dangle over the edge of a plinth and see if you get cramps just from dangling your foot in certain positions with it completely off. And see if any of these activities kind of provoke the cramping. Then looking at different things such as, I'm jumping around a little bit, but when I talked about water, I should have brought up also mineral intake. So are you getting the right minerals? Low magnesium can sometimes cause cramping. Some people I've known have kept a little packet of mustard next to their bed because there's magnesium in it that can help cramping. And that's if that's where it's coming from. So low in magnesium. Also, you can look at I had a cancer doctor suggest to a patient undergoing chemotherapy to drink like V8 because it has a lot of the salts and a lot of the things that that person needed, kind of those properties. Other people look at more the magnesium, the mustards, different things. Now, I'm not a dietitian. I'm not a nutrition expert. However, as a physical therapist, we have training in this area, but it's minimal. And then I would suggest that you go on to that expert if you have more questions regarding your mineral intake or your mineral situation to see if that's part of it. So just because you have Parkinson's doesn't mean you have Parkinson's related cramping. However, once we look at the skeleton and the muscles and we determine where your weaknesses are and or where your range of motion deficits are, we're going to work on those things because that alone can create issues, potentially cramping and pain. Now, once we've cleared all that and we've got the proper minerals, the water hydration is good, and you have a specific time or when this comes on, we kind of want to look at more, is your Parkinson's creating this? Because it's true, there are a lot of pain potential in people with Parkinson's. There's a great article that was put out in 2001 called Pain in Parkinson's Disease. Kind of an old reference being 2001, but it still is very credible in that it talks about the main areas. So usually the pain is going to come from some sort of a limb rigidity, which is what some people feel. It also can come from what's called dystonia. And your doctor may have used that word, you may be aware of that word, but other people don't know that dystonia can be part of the Parkinson's picture. And then also that limb rigidity, a lot of people feel that, and that's that, especially if you're taking medications, you know when you're on and when you're off. You also can have neck pain, headaches. Some people have pain in their lower back, and this is more of a dystonia type, could potentially be a dystonia situation. So how do you help that? Well, there's several things that you can do. Discussing this with your neurologist, your Parkinson's specific neurologist, is a great way to go. Now, they will sometimes, in conjunction with medications, looking at your medications, they may also ask you to come see a physical therapist to help you with some other things. So just want to say that if you do go back to your neurologist, they're going to maybe look at your on and off situation with your medication and maybe adjust the amount of medication you're taking at what time to kind of get you through this section, because the dystonia could be taking place from the medication you're coming off of or coming onto, and that needs to be figured out. And that's something you know as an individual. A doctor cannot necessarily guess. It's a prediction, but every person has a different body and a different way of assimilating the medications, different way of assimilating, or even the exercise you're doing and the movement patterns that you have. So if you bring that information to the doctor, kind of keep a journal. This is when it happens.
I was just going to say that.
Yeah, keep a journal. Because if that's really helpful for you to remember when it happens, how it happens, and write it down, the date, the time. And then keep that journal as you're waiting for your appointment to see the neurologist. And when you go in, let them know this is what's happening. Then you can start kind of massaging the kind of medications and see if there's something you can add in, remove, up or down, and kind of change that that situation so you don't have this dystonia. That's one way of handling it. And the opioid use for pain that you hear a lot in the news and different things is not a good way to go necessarily for Parkinson's patients. So I would suggest you do discuss these with your neurologist and not jump to pain medications because it could be clearly from you how and when and how much you're taking of your medications for your Parkinson's. Another thing with dystonia is if it's so severe, and some of you may have experienced this, where your toes, you go to put a shoe on and they're curling up so hard and fast, you can't even get that shoe on. I mean, even looking at a shoe will start bringing it on because you know that it's so painful when it happens. And people like that, again, need to look at that medication piece to make sure that you're getting a nice even amount and your offs and ons are correct. But then also there's the deep brain stimulator. And I'm sure some of you have heard that. It's kind of a last resort in a way, but oh, it works so well with people who do have the rigidity and or the dystonia in certain areas. And we've seen really good results from that. So I see people We do, as therapists, a pre-op test to see where they are with their rigidity and test things. And then we do a post-op and follow-up after they've had the brain stimulator placed to make sure that they are indeed seeing a change from this, and do they need to change the amount of stimulation that is occurring. So those are some options, and kind of from the low level of drink enough water, get enough minerals, which is kind of an aging thing because we tend to not thirst as much as we did when we were younger. So it's almost like we have to remember to drink that water, because it's not something you're going to say, oh, I need water. You have to just remember to take it, you know, spread it out every 2 hours, an 8-ounce bottle of water. Try not to drink too much right before you go to bed, because that does create more urine that needs to be expelled during the nighttime, which you don't want to be disturbed during your sleep. So after you're over 60, you know, getting up once at night is not unusual, but 3-4 times, that is not normal. So you might want to see a therapist for that. So those are kind of some highs and lows going from the water all the way to the brain stimulator. And I hope I gave you some ideas in between. So I was hoping maybe I could talk to you about some things we would do just to help you with your foot. Now they have talked about people who have pain at night. So a good thing to do prior to when that pain occurs, and this could work as well when you're in the gym and you feel some pain coming on, is to get a ball, and you could use any kind of a ball. I like these balls. This is a Franklin Method ball. You can get them online, Amazon or whoever, but it's little knobs on it, so you kind of have a better sensation. I use it a lot for my balance patients, but you can roll your foot on this ball and roll your foot back and forth and back and forth. You can sit down doing this and get a nice roll all the way out to the toes, all the way back to the heel, up and down. And so you're actually, the ball is just being rolled by the foot. I should show you how that actually works, right? Yes. Kind of hard to show you when it's not my foot.
And can you get those on the internet?
Pardon me?
Can you get those just on the internet?
Yes, you can get them on the internet. Amazon carries them.
So there is little bumps on there, because through here, it almost looks like there's divots, but these actually
like
little
a moon,
tiny.
like the look of the moon, you know, the little divots in the moon. That's what it
Okay,
looks like.
so
These
those
are
actually are
balls.
divots and not pokies.
Not pokies out. You don't need that necessarily, because you need more sensation and tickly. This is one that I use. I also use an orange one that's just solid, and that works as well. This one just gives more sensation. I use this a lot with people who have what's called peripheral neuropathy. And that's one thing I didn't bring up. Peripheral neuropathy is also something that can occur with all kinds of different problems as you age. It could be nerve damage, it could be vascular, it could be related to drugs, alcohol use, a lot of different things, chemicals that you were exposed to. So you get this numbness, tingling, maybe burning pain in your feet. So this is something that we do sometimes to relieve that as well. So if you're getting those sensations, that could be from something else that happened in your life before the Parkinson. So that's one thing I like to do, is back and forth, and spread those toes apart, really work at spreading those toes with the ball and moving back and forth. Another thing is, if you are, and I think Kimberly suggested somebody who gets cramps right before or right after they're exercising, and it comes on so quick and just starts from, I think you said, Kimberly,
from the upper thigh. And she said that it starts, she can feel it coming on. It starts upper leg and starts working her way down. And it causes almost a panic, because she knows as it's working its way down, it's going to eventually wind up at the foot and be very severe.
Yeah, and it is. Oh boy, when those come on, it's really important to get your muscles on a stretch and see if that helps. So that would be, if it's not dystonia. Dystonia is really hard to change that event because that is a particular neurologic event. But the cramping of the muscle post-exercise could very well be from lack of hydration, or just the muscles cramping up from being overused, that type of thing. I just want to show you real quick a picture of just how many muscles we're dealing with in that leg and foot. So you can see here all those muscles in the foot and the leg, and you've probably felt every one of those individually as you're having your cramping, especially in what's called the flexors, which are the ones that where your toes curl underneath you and then they pull back, and it's really, really uncomfortable. So if that should occur, I'm going to try to show you what to do, but if I felt that coming on, I would bring this down so you can see the floor. I would quickly get my foot back into a stretch with that heel down and my knee straight, and spread those toes out and lean forward. So just getting a nice stretch, not like this, you know, you got to get that knee straight because we're trying to lengthen the muscle that passes the knee. Okay, that's your gastrocnemius, all the way down to the heel. We're trying to stretch that really quick. And then if you have it coming on, like Kimberly said, sometimes you feel it up in here. You just want to keep that knee straight and the hip behind you. I'm going to try to get this a little bit higher so you can see. I'll get further away, kind of like this. And just get a really nice stretch. You may need to hold on to something for balance, and that's fine. But that type of a stretch is going to help you stop it, hopefully, before it gets too bad. So as you feel it coming on, stop, get that leg back behind you, and just stretch and breathe. So one of the things that we've learned from just pain education is learning that the brain is very, there's plasticity, the brain can change, your experience can change. So once you get in that position, it's important to do some nice, calm breathing. So you need your trunk to be upright, and you need to be doing the belly breathing. So nice, deep breathing with your belly, and try to calm your nervous system down. And hopefully that'll calm that nerve down as you're stretching a little bit. And so that might be a way to address that, especially when it comes on so suddenly. And then again, they're saying that ball rolling, especially before bedtime, if you get cramps during bed, before bed or while you're sleeping, rolling out on a ball and stretching those muscles in the feet, massaging it, which I know is hard to get your foot up to your hands, but that's a nice hip stretch. So it would be a good thing to try to do to maintain your hip mobility. Or if you have a partner, a loved one who can help you with that, just getting nice foot massaging would be good. And they're finding vibration. Vibration is helping with peripheral neuropathy. So if you have a platform where you can stick your feet on and vibrate them, now that's more for sensation, but that could also help those the tissues elongate with that information. So.
And have your many patients had success? I know we in the gym have lots of women who have routine Botox. What is your thoughts on Botox in the feet for cramping?
Definitely. I mean, that is actually before you do the brain stimulator.
Mm-hmm.
If the Botox is working, then you continue. It just has a lifespan. So you have to keep going back, depending how long your body will maintain that. So every 3 to 6 months, sometimes it'll hold up to a year, you know, decently, but it just depends on placement of the Botox and how well your body responds.
Okay. Anything else you can think of that would, you know, you certainly answered all of my questions for my ladies. It's such an important topic. It really, as you know, is debilitating, and those are all really good suggestions. And
good.
yeah, thank you.
So glad to help. Yes, you're very welcome.
Yes, and I cannot wait until we start getting into some time talking about pelvic floor health, since I know that that's a specialty of yours and certainly another problem, but today was about foot cramping. But I just thank you so much for speaking today. And how can they reach you if they would like to reach you and ask questions?
Oh, well, they can contact you, and you can reach me, and I can then give them a call or email or that type of thing.
Okay.
Feel free to, you know, just let me know. But I really, it's really a pleasure to speak about this and to let people know that there are some things they can do themselves. But if they need to see a therapist and or return to their doctor, those are really important things too.
Okay, well, thank you so much, Deb, and thank you, ladies, for joining me again today, and I will see you then tomorrow. Thanks a lot. Bye-bye.
Bye.